Thank you for coming down this afternoon, Director McCarthy and Mr. Cassidy. I oppose the proposed waiver because it will disrupt coverage and increase costs for Ohioans who have marginal incomes with insufficient disposable income resources to afford out-of-pocket health insurance premiums and compliance with other requirements. Healthcare Access Now is a nonprofit organization that provides community care coordination services in Hamilton, Butler, Claremont, and Warren counties. We are a certified pathways community hub that deploys certified community health workers who work with pregnant women and non-pregnant adults that are at risk or living with diabetes. The majority of our clients are enrolled in Medicaid or dual eligibles. We contract with 4 of the 5 Medicaid managed care plans for our pregnancy care coordination program. And we serve close to 1,500 individuals each year and partner with the Cincinnati Health Department, local social service agencies, health systems, and medical practices. One of the benefits of our care coordination services is a comprehensive client assessment that goes beyond the clinical and medical patient profile. The distinction of our services is to address the health-related social needs of clients, such as housing, healthy food sufficiency, transportation, and the existing barriers to Medicaid providers and access to behavioral health services. The number one most frequently cited need or concern from our clients is finances, and that's disposable income to ensure that rent is paid and that they have enough food to last the entire month, or pay for diabetes test strips that are not covered by Medicaid in order to monitor their glucose blood levels. This proposed waiver will place a greater financial burden, unnecessary stress, and further delays in seeking care. The proposed provisions would create the following changes for over 1 million of Ohio's Medicaid population. They would charge enrollees unaffordable premiums. Premiums have led to a decline in enrollment in other states. For example, in Oregon, enrollment dropped by 77% after premiums were instituted. Medicaid enrollees can have their coverage terminated for non-payment of premiums. Even though there seems to be some wiggle room in that, they're still terminated. And once people are off, they're not going to keep bouncing back and forth to get back on or off again. The private market coverage, there seems to be a provision in this waiver with the higher co-pays and deductibles that are now present with private health insurance plans are not going to be affordable for people who are making minimum to low wages. Instituting health savings accounts and debit cards, which will be costly to administer, as Ms. Bell wisely pointed out, and make it more complex for people to use Medicaid. Arkansas recently eliminated the imposition of health savings accounts and cost-sharing requirements on participants below 100% of the federal poverty level due to high administrative costs. The waiver proposes annual and lifetime caps, which were ended as a result of the Affordable Care Act. Medicaid recipients should not be subject to caps, which are now illegal. These changes would potentially override the benefit of expanded medical coverage, if now Ohioans will be expected to comply with additional regulations and cost-prohibitive requirements. Instead of adding more regulatory burden, we need policies that address the gaps in affordable and safe housing, equity in education, and employment. I also encourage the governor's office to evaluate the impact of this legislation on minority and ethnic populations, which can experience further gaps in access to care and drain on their resources. I urge the Ohio legislators and the governor's office to consider more progressive approaches to personal responsibility that provide for the opportunity for a livable wage that can move Ohioans off of Medicaid in the long term, instead of policies that will only result in a greater burden to public resources and assistance programs. Thank you for your time.